I would like to welcome you all, the strong, brave, and beautiful women in this webinar organized by the Women Development Cell of the MBLU College. Before moving on to the webinar, let me take this opportunity to introduce you all to our pillar of the college, our beloved Director Ma'am, Mrs. Jyoti Gaitonde. Words can neither qualify nor quantify how helpful her guidance and advice has been. She leads her colleagues and gets them to follow a vision of quality and value-based education to the students. Her valuable inputs and her compliments on our performance both motivate and inspire us to do better. Her leadership skills and years of experience makes it easy to manage our department even with our diverse professional background. Next, I would like to introduce our head of the department, Professor Manisha Sayani, who is also in charge of the Women Development Cell in our college. Her eye for perfection, punctuality, and leadership have made us more productive and converted all our skills into strength. She is one who transforms our mistakes into valuable lessons. She has an amazing ability to bring out the best in each one of us. Her never give up attitude and her passion towards her profession keeps all of us motivated. She's a charismatic leader. She's a pillar of strength, Professor Manisha Sayani. Now, not taking much of your time, let me hand over this to Manisha ma'am.
Thank you, Namrata, for this flamboyant introduction. As the Women's Development Cell in charge, I would like to take this opportunity to welcome all you powerful, energetic, highly talented women of MBLU College, which encompasses all students, coordinators, teachers, and non-teaching staff. And not to forget our very own dynamic Director Ma'am, and of course, our guest of honor, Dr. Khannan Bhatt. Before we move on with the webinar, I would want to say a few things about the Women's Development Cell. The Women's Development Cell was established in the University of Mumbai in the year 2001. It was done by the then Honorary Vice Chancellor of the university. The establishment of the WDC is indeed a landmark achievement of the university in pursuance of the policies of women empowerment within the university ambit. The aim is to build a gender-sensitive campus. The university has set up the UWDC to address concerns of gender discrimination and recommend measures and policies for gender parity at the university. After the Sexual Harassment Act of 2013 and the UGC guidelines of 2015, the university has set up the Campus Internal Committee to address complaints pertaining to sexual harassments. Further, the university has directed all its colleges, institutions to set up college internal committees as well. The university, as per the Maharashtra Public Universities Act, is preparing a comprehensive ordinance for gender discrimination and sexual harassment. The aim and the objective of the UWDC is to prevent sexual harassment at workplace, colleges and university campuses, and to promote a general well-being of female students, teaching and non-teaching staff on the university as well as its affiliated institutions and colleges. The cell is also responsible to undertake various awareness programs on gender sensitization, women's rights, and women empowerment pertaining to their health in university campuses as well as affiliated colleges. So before we move on with the webinar, I would want to say a few things pertaining to the intention in mind with which we have arranged this webinar on women's health awareness. We are teachers, we are mothers, we are sisters, we are daughters. We take care about everyone around us. We take care about the society. We nurture everyone who comes in contact with us. But it is high time that we also take care about our own health. And with this, I'd like to welcome Dr. Khannan Bhatt, our guest speaker. She is a well-known consulting homeopath, practicing over 2 decades, specializing in gynecology and pediatrics. Her research in cancer treatment and helping patients to overcome this disease with alternative medicine and counseling therapy has really helped patients to win over the battle with ease. The last few months, she has been successful in treating COVID-19 patients with 100% efficacy. Today, we have invited her to share her expertise and guidance on common diseases which prevail in young girls and women, which is PCOD and PCOS. It is high time that we strong women who take care of the society also give a strong attention and focus to our health and well-being. So here for you all is Dr. Khannan Bhatt. Dr. Khannan Bhatt, we from MVLE College, we are thankful that you are here with us on this platform, guiding our students and staff as well as teachers pertaining to our health. Over to you, Dr. Khannan Bhatt.
Hello, Manisha, and a very good morning to, I hope you all can see me. Can you hear me?
Yes, we can, doctor.
Yeah. So here I am, Dr. Khannan Bhatt, who's been practicing homeopathy since more than 25 years. And today I've got a real good opportunity and a nice platform by the MVLU College. Thank you very much, Manisha. Thank you very much, Director Ma'am. And I would love to share my experiences and give you quite a bit of knowledge regarding PCOD and PCOS. Okay, so now if we go in the short, PCOS meaning polycystic ovarian syndrome and PCOD is polycystic ovarian disease. These two names have been very, very commonly seen lately, very initially years, about say 15, 20 years back, it used to be, in the percentage wise, if we see, it would just be like 10 or 15% out of 100. But now we see almost 80% of young girls and young women suffering from this problem. And it is mainly all due to all our lifestyle changes and the early maturity levels, too much of exposure in media, too much of exposure with other things. And mainly the most important thing is due to the excessive hormones which have been given to the cows and buffaloes, which are transmitted to these young girls, and that's how they start developing these hormonal changes. Now I'll explain to you what do you mean by PCOS. Okay, PCOS is a common medical problem which causes a lot of hormonal imbalances or hormonal disturbances, commonly among women of reproductive age. It affects young teenage girls or early 20s and that age is mainly affected. But lately we also see this in 12 to 14 years of age. Initially it used to be only after 17 or 18, but now it is seen in a earlier age also. In this what happens, it affects the basic normal functioning of the ovaries. Now the work of the ovaries is very simple. It matures, the eggs mature in the ovaries and they are released in the uterus, forming a lining, and if it is not fertilized, they come out as your menstrual cycle, forming the uterine lining, and you bleed every month. That is the normal regular process. But in this what happens is that the ovaries that get enlarged with some fluid that gets collected, and which are known as follicles, they contain an immature egg which do not mature at all. And finally there is no ovulation taking place, and then there is no lining formed, and then there is no bleeding, causing a lot of imbalances in your menstrual cycle. This is, you cannot say that it is a disease, we call it is an imbalance. So there is no 100% cure to this disease, but yes, when we balance these hormones and we work on them and we help our system to function normally, this thing is 100% curable. Most of the time, it does not require major treatments and management. And if any medicines are required, it is treated easily with medicines. No, it is not a very big thing, or like people have to really worry, because I see a lot of patients who come over telling, oh, my daughter's suffering from PCOD and it's so embarrassing, and she's very disturbed, and there's a lot of bloating, and she's putting on weight, and there are many symptoms in which they are really confused. Now, if we go to see the main symptoms that are seen in PCOD, I hope everybody's understood what do you mean by PCOD or PCOS.
Children, if anybody has questions, you can definitely put it in the chat box. Since we are too many here, it becomes easy for the doctor to look at the chat box for any questions. If anybody has a question, you all are free to put it in the chat box. And at the end of the session, we will definitely try and answer all those questions.
Yeah. Okay. So mainly in this PCOD, there is irregular periods, meaning we call it amenorrhea, wherein you don't bleed at all. Sometimes you may bleed after 2 months, sometimes 3 months. In early menarche cases, sometimes girls don't bleed even for 5, 6 months, and then the parents are really wondering that what has happened. Like, she had started bleeding very well properly for first 2 years, and now all of a sudden she's not bleeding. And then when we go into investigation, we come to know. But the main thing nowadays which is seen is there are no symptoms at all. And people will just come into our place saying that she has a lot of hair fall. That's the only symptom, nothing else but hair fall. And then we have to wonder that why is it? She's eating very well. She's following a good, daily diet. She's exercising, but still there is hair fall. So then when we investigate, we come to know, oh, it is because of PCOD. So, like you would wonder, hair fall and PCOD, what is the connection between them? But it is mainly that because of the hormonal imbalances, your thyroid levels, the thyroid hormone is affected, your pituitary hormone is affected, and which causes all this main problems. Okay, so secondly, we come across people because I wanted to tell you that PCOD occurs because of excessive amount of androgen level. That is the male hormone, which is present in women also, but the increased level of androgen causes this problem, and therefore we get a lot of facial hair. Now, this facial hair, like facial hair around the face, around the chin, you get it on your breast, you get it on your back, and you wonder, all of a sudden this has started happening. And when we do the hormone analysis, we come to know either your testosterone has increased or your androgen level has increased. This causes all this problem that again leads to PCOD. The third and the most important symptoms, people just come out with a lot of acne. Their periods are absolutely normal. They have a proper 28-day cycle. There is no problem. They are, sometimes we wonder you must be eating a lot of outside stuff, and that's how you've got so much of acne. And they're big cystic acne, as if you have boils on your faces. And you'll go to n number of skin specialists, and they'll be giving you creams, and it just doesn't help. And like, you'll be wondering, there's no problem, and why is this doctor telling us to do an USG or doing a blood test? And then we come to know it is the PCOD. It is because of PCOD, the androgen levels have increased, so the oil secretion in your skin increases, which gives rise to this acne, and then this acne gets into secondary infection, causing big cystic boils on your face, leaving your face completely shattered. You would say, like, just 6 months back my skin was absolutely clear, and now look at my skin. And all these problems leads to a lot of bloating, a lot of weight put on, and finally this vicious cycle goes on to your mental phase, causing you a lot of mental stress. Girls go into a lot of depressive phase because they don't want to face the public because of their acne. They feel very bad, they feel ashamed, they feel, look at my face, how can I face anybody? Like, it is so embarrassing. And then because of that, they start putting on weight, their eating habit changes, and when they put on weight again, it becomes, loses their confidence, and that's how then girls go into deep depression. They just don't want to come out in the society, and then all these later on complications start, and then later on the periods gets impaired, and then hair fall starts, and then it all just starts together. When this chronic hormonal imbalance affects the complete overall health of the person. We call blood pressure, diabetes a systemic problem, meaning those problems affect your full system, right from your head to toe. Even PCOS or PCOD is a systemic problem. It affects you head to toe. If you have chronic PCOS and you have not treated it, you've not bothered, it can lead to infertility. And then, like, there are hassles at home, again causing depression and causing problems, family breakups, and n number of things. There is sleep apnea, which is caused because of you can say because of your weight gain. Your breathing gets affected and you don't get enough oxygen to breathe, and you land up with sleep apnea. And that's how then again your mental health is affected. So overall, it becomes a very vicious circle. When you're not getting your periods properly, you put on weight. When you put on weight, again there is a lot of pressure on your abdominal muscles, which make your uterine muscles very lax and very lazy, so they don't work properly, causing hormonal imbalance, so you put on weight, and that's how the cycle keeps going and going round and round and round. Okay, so you understood the main causes of the symptoms of PCOS. These are the main symptoms we'll go through again. It's acne, hair fall, irregular periods or no periods at all for few months, or erratic periods, sometimes in 25 days and sometimes in 40, 45, 60 days. There will be growth of hair on facial hair. There'll be a lot of acne even on your shoulders and back and the chest. There could be abdominal pains, abdominal pains during or before periods. And you will feel, I'm going to get my periods. This is the pain only related to your periods. And then you find out that there's no blood flow. It's only the pain. And then it just goes away within 2-3 days. And then there's no bleeding happened at all. So these are the main symptoms of and excessive hair fall. So please, girls, be very careful. You get any of these symptoms, immediately tell your parents, contact your closest physician, whoever is there, and go in for proper treatment. Please don't neglect these symptoms. They can cause havoc in your system later on in life, because it is easily curable. It is not a very big disease. It is just due to imbalance, which can be put into balance very fine, no problem. Now, if you go to see, how will you diagnose PCOS? This is only by the symptoms we've said. But we need proper proof as to whether I'm really suffering, anybody suffering from hair fall. If you tell them that, array, you have PCOD, they'll come and tell us, are you mad or what? We don't understand. Hair fall has nothing to do with PCOD. And that's the reason we do these diagnoses. The most important diagnostic investigation is your uterine sonography. So when you do the sonography, you come to know that whether your ovaries have been enlarged. Do they have follicles? If they have number of follicles, you call it PCOD, meaning the follicles then mature late and then they bleed. But if there is enlarged ovaries with fluid collection in it, then it is known as PCOS. Okay, so that is the main difference when we come to know through sonography. If you go to a gynac will always do a physical examination, and they come to know that your ovaries your uterus has become bulky. On examination, they come to know that the uterus is become a little heavy and it is difficult to examine. So that's how they go in for sonography. And the next thing we do is the blood investigation. In blood investigation, the most important thing is your thyroid levels, the male hormones, androgen and testosterone, and the insulin level of the body. These three are the main hormones that get affected. Sometimes it could just be mere thyroid issues. You can say the hypothyroid or hyperthyroid. Mostly it is hypothyroid. That is wherein you start putting on weight, and because you put on weight, the uterus gets affected, and that's how you land into PCOD. So your cause of PCOD is not the PCOD as in the symptoms of PCOD or the hormones, but it is because of your hypothyroid. So if you balance your thyroid hormone, your PCOD can be rectified. Secondly, androgen and testosterone levels, that again is treated with hormonal treatment, or it is we just leave it on the lifestyle pattern, basically we focus on losing weight, doing a good healthy exercise, and having healthy food. So these are the main most important things where we take care of your PCOD and PCOS. Now, if you want an exact difference between PCOD and PCOS, there is a marginal difference between them. It's not very easily noticed. So the sonologist who does the sonography has to be very particular in mentioning whether it is PCOD or PCOS. PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. So when it is a syndrome, it is basically a much more of a chronic problem and not a temporary disease or temporary problem. So PCOD is where the ovaries release many immature eggs which turn into small cysts, and these cysts enlarge and cause excessive androgen levels, and their symptoms are very mild. It's nothing major, and it can easily be cured within 6 normal cycles, and your PCOD is taken care of. There's no issues. Whereas in PCOS, it is a little more severe than PCOD because it is chronic. It has a lot of metabolic changes, meaning changes in your hormones. So that again forms a lot of follicular cysts, and these cysts hamper your ovulation. So your eggs are not formed. So when eggs are not formed, there is no ovulation. So PCOS can be a very important cause of your infertility, wherein you do not, you will not be able to give birth or get conceived easily. And the symptoms are very, very, easily noticeable. PCOS is very visible symptoms, and you can really detect it much faster. I hope the things up till now have been very clear and have been understood by you all. Any queries, dears?
Any queries, any questions so far? Any confusion, any questions so far? Teachers, coordinators, non-teaching staff, students, anybody, if you have any queries, any questions, please feel free. We all are women here. It is a platform where we share our thoughts without getting judged. So if you have any questions, please feel free to ask in the chat box.
Yes. So just a rough through, I explained to you what is PCOS. I gave you the symptoms of PCOS. I told you how to diagnose PCOS. We told you about the difference between PCOD and PCOS. Now, most important is the treatment. How will you work on this, and how will you get it treated or get it sorted? PCOS rather is absolutely a manageable problem, and which can easily be taken care with lifestyle changes. Most important is cutting off sugar out of your system. Now, most of the dietitians cut off on milk for PCOD patients. Main thing, again, I told you, because all are milking cows for the good quality of milk that the marketing strategies want for the business to grow. They have been injecting a lot of androgen and the hormones into these cows and buffaloes, because of which the milk has high level of androgen, it has high level of all the other hormones, and which when we consume causes a lot of imbalance in young girls and causing PCOD because the hormones have been imbalanced. So it is not very proved, it is not very well, you cannot say that, oh, I have PCOS means I must not have milk. It's not that. You can have, but most of the dietitians nowadays, they give you a diet in which they cut down milk or milk products for some time, and then again, once everything is settled, you can get back onto it. Milk, as in proper milk, when you have it, has more impact, but if you have curds, cheese, butter, yes, there'll be less damage in your system. So cutting down of sugar and junk food, again, our criteria is on losing weight. So if your weight is a big issue and has to be tackled, cutting down sugar and the junk is the most important thing to lose weight. So once you lose weight, your cycle again gets settled, and you will yourself realize, I was exercising, I was losing weight, and now my periods are normal. But the minute it was raining and it was boring, I stopped doing things, now again my cycle has gone haywire. So you yourself, you don't need any additional help. You yourself can help yourself by adjusting and improving your own lifestyle. Right? Now, healthy, nutritious food, as I said, I would appreciate if people suffering from PCOD have more amount of proteins, because when you increase your protein levels, your metabolism increases. Because in this, when you put on weight, your metabolism is going for a toss. So you are, and thus hampering your thyroid gland. So you develop hypothyroidism. Again, it's vice versa. If you have hypothyroidism, you get PCOS. If you have PCOS, you get hypothyroidism. So if you want to increase your metabolism, go for regular walks and have more of proteins in your diet. When you add proteins to your diet and decrease your carbs intake, you tend to lose more weight, increasing your metabolism. Once your metabolism is better, your hormones start, your glands start functioning faster. So the glands are no more lazy to release these hormones. What happens when the metabolism is slow? Your glands become very lethargic and very lazy. So they don't release the necessary hormones needed for your system to work properly. So the minute you improve your metabolism, your problems are completely solved. So again, low carbs, high protein diet, healthy nutritious food, cutting down on sugar and junk food.
Ma'am, just one question. I'm sure we all know what carbs and proteins are, but there could be some students who don't know what carbs and proteins are. So if you can just give examples of what are carbs as in food wise and what are proteins, just one or two examples, and then they will, kind of understand or follow.
Okay. So proteins, wherein we would add more of pulses. If you're a non-vegetarian, you can add egg to your diet. You can have, roasted chicken. Fish is also very good, although it doesn't give you too much protein. But omega-3 is again a good ingredient for all these hormonal issues. And for vegetarian people, you have very good sprouts is very rich in protein. A bowl of curds every day is very good, rich in protein. And basically, proteins are dals, pulses. So your rajma, chole. If you can't have, or if you have gas issues and you can't have this, you can even go in for protein biscuits. You have threptin biscuits. You have protein powders, which if you have every day, once a day, like how these Horlicks and Bonvita there, but those are not like protein powders, but proper protein powders are, we get this Protein X powder, we get Ensure powder, we have these protein powders, those are also very good. But diet wise, a bowl of sprouts, evening snacks, if it is like shing chana, it is the best. It is light, you've drained your energy through the day, and evening you need energy, just have that. And carbs is all our fatty foods, like lot of rotis, rice, which is very sticky. So those things, they settle in your stomach and they make your stomach so bulgy, causing bloating, which makes you lethargic. And so for a good and healthy thing, it is always better to have an early dinner, preferably a dinner before 8 o'clock. If you are sleeping late at night, have any protein in the night. You could just have few almonds in the night, or just a little bit of salad in the night, but don't have any carbs after 8 in your diet. That will really change your life system a lot. Here we have Urvi Upadhyay, who has given this query that she gets her periods every month, but the bleeding is irregular. And there are other symptoms also. So, Urvi, I would really advise you that you should really investigate yourself, get a sonography done. No need to do the hormone test right now. First, we should just do a sonography and see whether you have any PCOD issues or no. If not, then we can work on, what could be the other reasons of your symptoms. Whether it could be thyroid or whether it could be insulin resistance, that we can do the blood test later on. Got it, Purvi? I hope it has been solved. Priya has a question that she gets her periods 1 week every month. So if she gets late every month, if it is 1 week late, so if you count your cycle as a 40-day cycle or a 42-day cycle, then it is a normal cycle, meaning your cycle, your menstrual cycle is for 42 days. And if you're getting this every time at exact that date, then you're absolutely normal. There is no issues. there is no problem. Coffee affect periods. Coffee not as such, but if you have too much of caffeine, then yes, because then again it becomes habituated, and that will hamper your issues. I hope things have been sorted till now. We'll go on our next step, wherein we were talking about treating the PCOS. The most important treatment chapter of our PCOS is exercise, which 90% of people avoid. Exercise 35 to 40 minutes is must. Exercise for your pelvic muscles, exercise for your abdominal muscles, cardiac exercises, these are must. If you regularly exercise, you will never have any issues regarding your periods, because our uterine muscles get lax, get lazy, because they are not worked upon. Only when we work on our muscles, they are active. Our body system is so lazy. Even if you don't use your arm muscles for some days, you will see that you are not being able to put up your hand. All our muscles, they are real lazy bums. You have to really hit them and make them, you have to use them. The same way, even our uterine muscles have to be worked upon. A simple 35 to 45 minutes walk is also enough. It's not necessary that you need to go to the gym or you need to do a lot of yoga, you need to do a lot of things. But a simple walk, a rapid walk, is also very, very effective in these issues. Rest other exercises is abdominal exercises, where you do your crunches. They are very, very effective. Pranayams and yoga is also very effective. We have certain yogic exercises which are very, very good for our pelvic muscles. There is, if I just name a few, there is Yashtikasan, there is Mandokasan, we have this, the boat asana. I am sorry, I can't remember the name, but wherein you sway like a boat, keeping your abdomen on the floor with your head and legs. That really helps a lot. There are a few very good asanas which are very, very, very effective, and they even help in treating not only PCOD, but if people are suffering in elderly age for fibroids, they are very, very effective.
And there's one question.
Yes.
Actually, we have two links, because we have right now currently around 164 participants. So we have two links with which we are doing this webinar. So on the second link, we have one participant, Hital Shah. She has said that, can PCOD or PCOS cause boils or pimples on the buttocks, as in on the bums, which lead to some dark spots, which cannot be treated by a dermatologist? Are the boils, I mean, you said it could be acne, that is face and shoulders or chest, but does this also affect on the other parts of the body?
Yes, because see, as I said, this PCOD causes high levels of androgen, and the work of androgen is to secrete a lot of oil from your skin glands. Okay, so your skin is all over the body, so you may develop boils anywhere, but mostly, like, because why did I say acne was because we see a lot of patients suffering from that. But on the buttocks also, there could be other reasons also. It could just not be PCOS. But yes, PCOS can cause boils anywhere over your body. I hope she got it.
Thank you, ma'am.
Yeah. Neha, you have a query saying, ma'am, every month my blood flows very much, but the difference, it could be that because maybe you had some, you were sick or you didn't have a good diet, and all of a sudden loss of bleeding in your periods, just one cycle or two cycle, is not very common. I mean, it's not troublesome. But if this persists, that initially you were having a very heavy flow and now it is becoming scantier, then yes, it is a matter of concern. So if it is only just for 1 month, then it's okay. You can observe the next 2-3 cycle. If it is considerably reducing than before, then we have to check into even your hemoglobin levels and your multivitamin levels. Muskan.
Again, students, it is a humble request that the webinar is for the general knowledge about the topic. If you have any such questions, ma'am can give you a generic answer, but for further investigations, you need to go to your own doctors or your gynecologist and understand what is the root cause of your problems. Am I right, doctor?
Yes, yes. You have your ma'am has my number also. If you need any additional help, you can contact me on personal level, and then we can help you out solve your problem.
Yes, ma'am.
Yeah. Okay. So now, as I said, that PCOS is a physiological problem. What do you mean by that? PCOS causes physiological, meaning affects your full system. Symptoms wise, I told you. But if it is not controlled for long, it can lead to a patient getting diabetes, because again it is insulin resistant disease. So the person may suffer from diabetes. They may develop high blood pressure, and even it can lead to cardiovascular disease, because you tend to put on weight. Because of weight, the circulation is affected. Because of the circulation, there is pressure on your heart, the blood pressure increases, causing cardiovascular diseases. So that's it. And then basically, can I answer these questions once I finish the leftover part? Because
Yes,
then it'll be easier for me, and if your queries are within these answers, it'll be easy
yes,
for you also.
yes, ma'am. You
Yeah,
can
we
pick
have
up those
Muskan
questions.
Pandey. I'll
Ma'am,
just give you your answer in some time. Neha, I hope
ma'am,
you're
am I
answering.
audible?
Yeah.
Okay, so what you can do is at the end, around at 12 o'clock, we will have, you can go through these questions, and you can just pick up the common questions, answer them, and any other questions which are a little different, you can answer them. So if one question is already answered, then you can automatically skip that question and go to the next question. So at 12 o'clock, you can look into the chat box and you can answer all the questions at one time. You can continue with your session right now, no problem.
Yeah. Now the final base is, how will you manage your PCOS? I've almost said these things initially, but now we are just specifically mentioning one single points of managing your PCOS. Main thing, as I said, lifestyle changes and medicines if needed. There are certain medicines we give, progesterone level medicines, and then there are other medicines given at this moment. If you want to avoid a lot of allopathy medicines, and if you can improve with managing your health, with your exercises and your lifestyle changes, homeopathy plays a very big role in treating PCOS, and we have got excellent results in my life up till now, with very good results. And none of my girls needed to go in for any HRT, meaning hormone replacement therapies. Always talk to your parents regarding these issues. Even if these things, it should not be that I'm not going out and parents are busy not observing, and they are developing acne and there's hair fall, and people also develop a lot of alopecia, bunches of their hair is lost, again making them going into the shell. They're not happy coming out. So at that time, the parents have to be very, very careful, and children should surely share these things to their parents and get this sorted before we reach the next level, causing depression. So this has to be surely taken into consideration. Young girls nowadays have started having these issues. As I told you, initially it was always seen after 18 years, but nowadays in young girls also we see this, as I have mentioned before. That is because of the hormone therapy given to the cows and the buffaloes. Teens and later teens and early 20s have these issues because of sudden lifestyle changes. We have girls who have been studying here, and suddenly they go abroad. Now when they go abroad, there's a complete climatic change, complete lifestyle change. uh, uh, there are a lot of mental turmoil, physical changes happening. You're meeting a number of people, so those changes also sometimes cause PCOS. It is just, you would like it, you could not even imagine that something like this can happen. And you've gone to states, you are at the best place, it's so clean, it's so pure, still you are having acne. How come? Up till now your skin was clear, now you've developed acne. Oh, it's because of PCOS. uh, there are young girls who just got married in their early 20s, and the lifestyle changes in their family. There are mental stress, and or they are completely free, not eating home food, eating out food most of the time. They had regular periods before their marriage and everything, and suddenly they develop all these irregularities causing PCOD. Food habits. Now, in later years, there are people who've delivered children. Everything has happened. They've been having a healthy period cycle. Now, 35, post 35, 35 years of age, they develop, now I'm getting irregular periods, and like there's no reason for it. Like my children have grown up. Is it early menopause? That's what people come and tell us. But sometimes it's not menopause. They develop PCOS late in life. Again, because of hormonal imbalances, because of thyroid. Most important hormone that causes imbalance is thyroid in our system. There are young ladies of the age of 40s, mostly initial when they got married earlier, at the age of between 38 and 40, the children are in 10th and 12th, and there's a lot of pressure in a mother regarding the education of the children. And you won't believe, we have actually observed that majority of women who develop thyroid and period issues are between 38 to 40. And we'll say, why that age? But that is the age when most of the children are in 10th and 12th. So they are under so much of pressure, whether you call it peer pressure or the children's psychological tantrums or study pressure. Equally, the parents or the mother also goes through all this stress. And that's how at that late years also they develop these issues. If this PCOS just goes continuous without any treatment and you just don't bother about it, it can be very alarming, causing endometrial cancers also. That's not very, very common, but yes, because most of the time we do tackle the issue and we do take care. But there could be cases where the parents are not well educated, there's no exposure, they can't meet the doctors, not going, financial issues or stress at home, not allowing the girls to go out, XYZ reasons. And it is neglected. Okay, it's neglected for years, and they may develop ovulatory cancers or endometrial cancers at a very young age of 35 to 40 years of age. So that can be very, very alarming. Again, at 35, between 35 to 50, if PCOD is not diagnosed, they may develop hypothyroidism, they may develop diabetes, they may develop high BP, physiological health changes, cardiovascular system, everything goes for a toss. So majorly in elderly patients, these are the main symptoms that we go through. I think I've covered most of the major topics major pointers pertaining to this PCOS. So
Now, I just want to want you to highlight on one point,
yes,
that there is the reason of inviting you as a guest here is because you are a homeopath. There are two kinds of medicine, or I would say three kinds: Ayurvedic,
Ayurvedic, Unani.
Yes, there are various kinds of medicine. I just want you, in a very brief, give them a highlight on what could be a possibility of an alternative medicine along with the regular medicines, which are very, very essential, so that there is no harm to the body, because alternative medicines, they do not really harm the body.
Yes.
Along with that, allopathy, as in the regular medicines, are required to speed up the process of healing into the body, because if I am not wrong, homeopathy takes a little while to heal or give results, but then those results are lasting. So a little highlight on that not only homeopathy, but what could be an alternative medicine which is less harmful to the body,
rather not harmful at all.
yeah.
First and foremost, I'll just remove the myth that homeopathy takes very long to heal. It is completely a myth. PCOD, we'll just talk about regarding PCOD treatment right now, where in allopathy also there are very good doctors who will avoid treatment as far as possible. They will give you diet and lifestyle changes. But if it is too bad, they give certain allopathic medicine which you need to take. There are certain doctors who tell the patients that please go in for homeopathy, and homeopathy has very good results in PCOD, and PCOS, you continue that. So we can take homeopathy and Ayurvedic or Unani medicines with allopathy. There is no harm. They work at both different levels. They have no connection between them. They don't contradict each other, rather they complement each other at times. That's one thing. Secondly, PCOD is something which we can see only when you get your period cycle, which you get only once a month or in 30 days or 35 days. So any which ways, even in allopathy it will take time, even in homeopathy it will take time, even in Ayurvedic it will take time, because till you don't get those normal cycles, 8 to 10 normal cycles, the treatment will continue. Otherwise, people will say, when I took the Primalutin, I took progesterone tablets, my 4 cycles were absolutely normal. When I stopped that, the periods again became irregular. So at that time, when they are taking their progesterone, if they start taking homeopathy, and the results will be much, much faster. Normally, in my practice, I advise them that they should continue treatment till they get 6 normal cycles. If they get 6 normal cycles, then there are very rare chances that there is any reversal or they develop again. Secondly, as I said, the treatment wise, allopathy and homeopathy go very well hand in hand, and PCOS again leads to other symptoms like constipation, the mental health I told you. So when we treat it homeopathically, we see the patient as a whole. We don't see PCOS, like we don't give you only hormone therapy. We see the patient from head to toe. So we take their constitution, we take their mental health, we take their physical symptoms, acne, or if their weight or whatever the issue. Everything is considered at one go. And I have seen patients who why do they develop PCOS? Is because they are very conservative or very introvert. When patients are very introvert, they have these issues. They have developed constipation. They can't let go of anything. Because they can't let go of anything, your subconscious mind does not release the egg also, and that's how you develop PCOS. So this is what we have observed in homeopathy. All these things normally they don't consider in allopathy, but in homeopathy we have these things, and that helps the patients a lot. They feel that all my other symptoms have also got all right. I was suffering from acidity, I was suffering from constipation, I was a very introverted, now I'm talking to people. So all these things also are tackled very well with homeopathy. Got it?
We have few teachers here, Sneha ma'am, Sangeeta ma'am, other teachers. Any questions from your end? Do we have Sangeeta ma'am here? Sneha ma'am, IT? Pradnya ma'am? Any
Yes,
questions?
Marina ma'am, yeah.
Marina. Any questions from your end, teachers, non-teaching staff, please? Let's all be very free to use this platform productively to ask whatever questions we have.
Yeah, I'd actually put up my question, doctor.
Yes.
There's only hair fall as a symptom.
Yes, I just said that.
Yeah. So what are the tests that would you recommend as in?
Immediately just hair fall, and all of a sudden if you've developed hair fall, as I said, we have to check into your diet, whether there has been any dietary changes.
Not
Secondly,
immediate hair fall, doctor. It's about one of my sister. She had alopecia.
okay,
So she had alopecia, but then that was treated, and then again, as in it keeps on coming, it keeps on repeating. It's
we have
alopecia
to check
something.
her multivitamin levels. B12 and D3 is must. Vitamin E levels also have to be taken into consideration. If all this is normal, lifestyle is normal, then we need to do a blood test and do the hormone assays, what they say.
Okay, so better go for a blood test to check the
Yes.
vitamin level.
Yeah,
Okay.
but then as I told you, in homeopathy, we don't believe much into all these things. So we go with the symptoms. We work with the symptoms. If there is no improvement in a month or 15 days, then we advise them to do a blood test.
Correct. She was actually taking homeopathy only.
Yeah,
She was
then she
taking
should do the blood test.
homeopathy for alopecia, but
Yeah,
then
it has excellent results.
yeah, so it was all gone, but then it keeps on repeating. Like, alopecia does not, has a
Yes.
complete cure.
Yeah.
So it
Then you
keeps
need
on
to do an
repeating.
hormone assay completely.
Okay, so then will there be any medications after that, or how is it?
Yes, yes, yes. We'll have to give them medicine.
Medicine after that.
Yes,
Okay,
yes,
okay. Thank you, doctor.
yes. Vaishnavi, you have a question. Eating spicy food or pickles on periods does cause more bleeding or cramps. Yes, it does cause more bleeding and more cramps because any heaty food. In our traditional language, they say you get more bleeding because there is a lot of heat in your body. There are these things traditionally being said. So when you eat too much of spicy food, there is a lot of acid secretion in your body digestive system to digest this food, and that's how it can cause more of cramps because there is more pressure on your abdominal organs. There are these girls who get irregular periods right from the beginning. Yes, that is a matter of concern and has to be surely looked into it. I had a girl of who had turned 18, 19, rather 20, and she didn't get periods at all till that age. And there was things of getting her married, but homeopathy really helped her, and we found out that she was suffering. There were a lot of follicles in her system which were not allowing the blood to flow and causing other problems, and which was completely treated. Today she's very happy, married, and even got a kid. So periods, irregular periods, not getting periods properly has to be surely be looked into.
Ma'am, one question on the other link. If
Yes.
somebody is still getting their periods at the age of 50 and 50 plus, that means if they have not got into the phase of menopause, is it okay, is it safe, or is it a complication?
See, if 51, 52, till 55 years of age, there is no problem at all. But after 55, suppose if they have any symptoms like a very heavy flow and the periods are not in control, they're getting a lot of abdominal pain and there is other issues, then yes, then it has to be looked into it. We have to do all the cancer analysis, all the cancer investigation tests has to be done before thinking as to what could be it. Like normally, latest by 55 years, it has to stop.
Okay, ma'am, thank you.
The normal period cycle is 35 to 40 years. Okay, so if you bleed by sometimes it goes up to 45 years. So if you bleed say by the age of 10 or 14 or 16, initially girls would get periods only after 15, 16 years. So their menopause, if you see our mothers and your elderly people, their periods lasted till 50, 52 years, 53 years because they started bleeding late. The menarche was late. But now, because of exposure of the TV, the media, the lifestyle changes, you have tiny, tiny girls and boys talking about girlfriend, boyfriend. So the hormones start secreting, starting acting on your system, reproductive system much earlier. So we have girls who get periods from 9 years and 10 years also. So in those cases, sometimes they even develop early menopause, or their menopause gets over by 40, 45 years old.
Ma'am, one more question. Somebody's written, what should be the ideal healthy blood color during periods? Is there something like
Yes.
where you can, judge whether you are healthy or not with the help of the blood color?
Okay, now the blood that is coming out, if you understand the physiology, it is the lining on the uterus. So when we have a uterus, there is a lining which just scrapes out and comes out as blood. So the initial blood flow that comes, sometimes the beginning of the blood could be patchy, a little blackish, but the proper flow will be bright red blood. Okay, and during the end, when it is the end of the uterine lining, the last part of the lining that comes out is normally dark brown blackish at the last day, or in a few chunks, but not otherwise. It is completely bright red. If you have fibroids issues with all these things, then your blood can get a lot of clotty, or it can get really dark blackish and brownish. But a normal cycle, it is bright red. How much blood flow is normal? Okay, that depends completely on person to person. It depends on from the time what has been your cycle. A normal cycle, normal blood flow would be like that initial 2-3 days it's a little heavy, and from third, fourth, and fifth days it subsides. So 1 to 6 days is normal blood flow that takes place, but after that, if it bleeds, it's excessive, and if it is less than 3 to 4 days, it is really scanty.
Any other questions by anybody
Yeah,
else?
somebody who's given a very difficult, a different question, and it's really very important. We have somebody, Khushbu, saying that does vomiting in periods week indicate? What does it indicate? How can we get rid of it? Again, when I said there is hormonal imbalances, the progesterone level increases in your body before getting your periods. So, and progesterone level, if you are like in the early years of pregnancy, what happens is you get this vomiting sensation. That is again because of the hormones. So these hormones again cause this vomiting in the periods week. So you should not bother much about it, but at the same time there is treatment for it in homeopathy, which we can really get rid of easily. Okay. Sometimes in a month's time, period, there are people who come and say that we got periods twice in a month. So if you are saying that if your cycle is 28 or 25 days cycle, then it so happens that you get in first or second of the month, and you will again get at the end of that month. And especially if the month is a 31-day cycle, then it does happen that in 1 month you get your cycle twice. But suppose you get it around 10th and then you again get it around 25th, then that's a little abnormal because you've got it just in 15 days. And if that repeats again and again, it has to be looked into.
Ma'am, one more question.
Yes.
Ma'am, just wanted to ask, like, is the white particle discharge a lot, like literally a good amount, more amount? So is it, what is the sign like?
The white water that comes out is known as leukorrhea. Okay, so that really normally says it's a reason due to malnourishment. Secondly, because of unhealthy uterine lining or the cervical lining rather, or any fungal infection in your cervix can cause these issues. But before getting into investigation, we have to see the hygienic and the nutritive level of that patient, because most of the time they are malnourished patients who have these issues, or a person with a real hectic lifestyle and not having enough water and not having enough nutrients.
Okay, ma'am, thank you.
Normal flow for 1 day and decreasing on the second day, that is normal. Again, we consider the age. This is not normal in young age, like if you say till 25, 28 years, it is not normal because you should get a proper flow for 2-3 days and then it should decrease. But otherwise, the flow normally is excessive on the first 2 days and then it keeps decreasing.
Hi, ma'am.
Yes.
Sorry to disturb, ma'am. Ma'am, actually, even I had a question. Ma'am, having breathing problems before periods and
I'm sorry, I didn't get you.
Ma'am, breathing problems.
Breathing problems. Okay.
Yeah. Due to the flow, does it results in the breathing problem before also? It's a symptom before period, and after the period gets completed, like 5 days के बाद भी ये symptom होता है, तो it's natural or it's
No. We have to first, most importantly, check your hemoglobin levels.
alright.
Because if you have depleting hemoglobin because of excessive blood flow, breathlessness does take place, or you feel very tired and exhausted.
Yes.
So you have to check your calcium, vitamin D3, and hemoglobin and your iron in your body. If these are in low quantities, then these symptoms are surely going to be. And I'm sure these are the only reasons. No other reasons can cause this problem.
Okay. And ma'am, one more question. Sometimes due to the flow, heavy flow, like periods are for 3 days. It's lasts for 3 days, and at night the flow is too much, or in the working days as well. So sometimes अगर flow ज़्यादा हुआ तो 3 days होता है, and अगर normal है तो 5 days, 4-5 days जाता है. So it's not in a regular flow that it's 3 day का process, मतलब 3 days ही होगा या 4 या 5 days तक जाएगा. So sometimes due to the flow also, heavy flow, it's 3 days. And if it's a normal one, so it goes on to 5 days.
5 days. Because we can't see the lining from outside, right?
Yeah.
So we don't know how thick your lining is.
Yeah.
Normally, in a sonography, we come to know that when you're going to get your period, the lining of the uterine wall, the endometrial wall, will be about 17 to 18 millimeters. So that full lining has to be scraped out. Suppose you get a heavy flow initially and half the lining is already removed, The other half will be removed in next 2 days. So your flow cycle will become less. But sometimes if it comes out slowly, then it may last for a few days. So, but that's nothing to worry about. That happens. That's normal.
Thank you, ma'am. Thank you.
Somebody asked me about the menstrual cup. Yes, menstrual cups are really, really very safe and very hygienic. And if a person is comfortable using them, then they can be easily used very well.
So with this,
1 minute, I just have a few questions over here. I'll just complete them. Ma'am, is reusable pads safe or not? Reusable pads meaning you mean the cloth? We normally don't call them safe because of the hygiene purpose, because we don't know whether the amount of, if there are any bacteria left. But if you are hygienically very clean and if you are sterilizing your pads properly, then there's no issue in using them. By this pain or cramps, there is no extreme pain or cramps in periods, but yes, dysmenorrhea is a very common symptom. When the lining is going to be scraped out, there are a lot of uterine cramps happening in your body, which cause a lot of abdominal pains and lot of cramps. So it is a part of your menstrual symptom, and that just goes away with age, or as you grow it becomes all right. But yes, again, for dysmenorrhea there are medicines and that can be treated. Facial hair, you have to check into your hormones, especially the testosterone and androgen levels in your blood.
I think, ma'am, we have answered most of the questions. The questions which are coming are kind of a little repeated. So anyone else, any teachers, coordinators, any non-teaching staff, anybody else, is bleeding 7 days normal as?
Yes.
Yes, ma'am said it depends on person to person, depending on how thick your lining is.
One most important thing I'll tell you is, which after this question I've come to know, taking painkillers for period cramps. Yes, when you take painkillers every month regularly, I have seen patients developing PCOD because of that. So try to avoid painkillers. You can take it on and off, but not regularly.
Ma'am, if I'm not wrong, a hot water bag would also help them.
Hot water bag is there. There are home remedies. There is ajwain water, jeera water. Those things are very, very helpful. Avoiding bread, avoiding spicy food, all these also help.
So, any last question? Because
yes, hello, ma'am. Yeah, hello.
Yes, Neha, ma'am, please.
Yeah, what is the bleeding pattern during the menopause, ma'am?
Menopause is very different as menarche. Menopause is a phase of 2 to 3 years, and it's completely different. Sometimes people may just bleed every 15-20 days for 2-3 cycles, and then they'll bleed for after 2-3 months they will bleed. You don't know. It's very, very different. It's very erratic. Only a physician, or normally when people come to me, we consider the other symptoms or the body functions, and then according to that we decide whether the person is going into menopause, whether they're having fibroids, or whether it's just normal menopause.
Thank you, ma'am.
Anybody else? Anybody else?
We have somebody who said that initially they didn't get pain, but now they get cramps and abdominal pain. That's again because there could be a fat accumulation around your uterus, and because of the pressure on abdomen muscles, it causes pain. So you need to exercise and look into that. Harshili Dolam, I'm sure it could be possible that you are having PCOD. So get yourself examined, please. Because there is hair fall, there is leg cramps, there's stomach pain, and there is facial hair also. So that has to be looked into, please. I have done a lot of work with females and in children. So if anybody has any queries, you could feel free to contact me personally.
Yes, ma'am. What I will be doing is, This webinar was definitely very helpful, very insightful in understanding what could be the basic symptoms pertaining to women's internal health, which are so different from, of course, the men. Ma'am is definitely available on appointment basis, and of course you all are free to please visit your own doctors, your own trusted yes, for guidance. And just in case you want to also visit ma'am personally, I would be putting her number here on the chat box, or you all can text me personally and I will pass on her details, and you all can call her up and take her appointment and visit her. Otherwise, you all can also go to your normal doctors, take their advice and then proceed. Whatever ma'am has explained here is generic, and unless and until the doctor personally sees you, understands your symptoms in detail and gives you a kind of an investigation, please do not imply it on yourself. Do not get scared. Do not overthink. All right. This was a generic information.
Yes, that's most important. You can just not say that I have these symptoms, so it is PCOS.
Yes.
It has to be diagnosed by a physician. It has to be looked into it and then treated accordingly.
Okay. So, ma'am, I will just put your number here. She is Dr. Khannan Bhatt, as I said, a practicing homeopath. She is having her personal practice in Khar West, very close by to the station. I will put her numbers here, and in case you want to meet her only. Otherwise, you can also go to your physicians, your doctors, or your trusted people whom you've been taking medicines for so long. But most important thing is, this is an informative webinar. Do not overthink, do not self-assess, do not mull over your symptoms and put yourself under stress. In case you have any such questions or you want clarity, you need to go and visit your physician or any other trusted doctor before, thinking.
Always take medical advice.
Yes.
We have, ma'am, how do we reach out and talk to our parents about this? Yes, this is a very, very important question, because there are parents, or in fact, there are families wherein talking about periods in the house is a very big issue.
It's a taboo.
They can't, it's a taboo, like you can't talk in front of your father or your brother. But somehow you should get comfortable with your mother and talk to her. If you have some friend who can discuss with your mother or your parents, or if you have any sibling with whom you can discuss it out, get into it, talk to them and see that it is all right.
But again, someone who is elderly, not someone who's of your age, who's going to confuse you more with their own thought processes. Please find some kind of professional help, personal help, but someone who's elder and who will be able to help you out in a more better manner rather than confuse things for you.
Sure.
Okay. So we are really, really grateful, Khannan ma'am.
Thank you very much. Even I've really enjoyed. There have been such good interactive questions. I hope I have answered everybody well.
Yes, a few other questions, but they are repetitive. So I wouldn't want to take much of your time. We are really grateful here at MBLU, teachers, coordinators, staff, students, management, that you have, given us your precious time and your knowledge pertaining to this. We are really, really thankful, ma'am. And
thank you very much.
Thank you, ma'am.
It's my pleasure. Thank you.
Yeah. Ma'am, I will connect with you after closing this in some time. Thank you so much. All right, students, thank you so much. Our initiative here at Women's Development Cell, now that the doctor is not here, our initiative at by the Women's Development Cell to enhance your knowledge pertaining to your internal health. I hope you found it informative. I hope you guys liked it. In case you have any questions or you want to take appointment, please consult your parents first rather than going out all by yourself, going to your doctors. It's very essential that you take your parents into confidence. I will put Dr. Khannan's number here. In case you want appointment only, then call her, because it will not be nice if we just call her up and ask her our questions. Secondly, I would also advise that it is best that you take your parents into confidence. In case you are having some problems, go to your trusted physician or doctors. And yes, that's about it. Any other question that you have for me or the Women's Development Cell? This is Professor Manisha Sayani, as told to you all earlier. I'm heading the Department of BMM, BA, MMC, and yes, also in charge of Women's Development Cell. I'm really thankful to all the coordinators, teachers, non-teaching staff who have joined us here. I'm thankful to the students who have given their valuable time and contribution here. I hope this was definitely a very, very insightful session for you guys. Thank you so much. Thank you. I would want to end this webinar here. Thank you so much. Thank you, Uri. Thank you. Thank you, Parna. Thank you, everyone. Thank you for your support and your presence. Thank you.